People are losing their lives. We are demanding action today.
Naloxone, it's a life-saving drug that's in short supply in Manitoba. And now a Manitoba politician is calling on the federal government to take action, saying the low supply of naloxone is costing people's lives. Earlier today, against a backdrop of community organizations and members of the provincial NDP, Winnipeg Centre MP Leah Gazan called on the federal government to get naloxone flowing to Manitoba, saying organizations and the public are in need of the life-saving drug.
And our community is not going anywhere. We are going to gather more and more people in critical mass until all levels of government take a public health response to the overdose crisis.
The call for increased naloxone supply in Manitoba is part of a larger ask from both community and opposition for governments to take a public health approach to the overdose crisis, saying if the provincial government will not act, the federal government must step in as drug toxicity deaths in Manitoba reach record highs. Davey F. Cole with Sunshine House, which operates mobile harm reduction services in the city, says the situation is getting dire, and if it wasn't for community supporting community, more people would be dead. Cole says a survey conducted by Sunshine House of service providers found overdoses are requiring more and more naloxone to reverse, creating greater demand.
And it came to about an average of 7. So for us, though, our numbers are much higher. So we've been seeing a few ODs in the last month, and it's been taken the last one, it took 21 doses.
The shortage of naloxone is just one issue community members have been flagging to the government, as they've also been sounding the alarm about a need for a safe supply, a supervised consumption site, and drug testing facility, none of which exist in Manitoba. In a statement, the government of Manitoba claims there is no shortage of naloxone itself, but there was a supply chain issue that delayed orders. The province says it's received and distributed 2,000 kits last week, and 1,000 of an additional 10,000 kits have arrived and are now being applied to orders, with the remaining 9,000 kits expected to arrive early next week when supply issues are resolved. However, some members of the opposition NDP are accusing the government of lying, with other community organizations saying the province's messaging does not match the reality of the situation. And for people like Megan Michelle, an outreach worker with the West Central Women's Resource Centre, she says the situation will be one of tragic loss unless it's changed immediately, saying an endless supply of the life-saving drug is needed.
It's not only my community members, but it's also my physical relatives that are going to be gone. So it needs to be heard, and we need more.
In Winnipeg, Morgan Majeski, City News.